I'm Marian Uy, and in this video, I'm going to perform bag technique and urine testing. Now, this is our CHN bag, and all the materials that I have here in front of me are all the materials that we're going to need inside the CHN bag. So first, I'm going to show you how are we going to arrange all of these materials inside the CHN bag. So first, in front of the bag. In front of the bag, that will be from left to right, we're going to put our oral thermometer, rectal thermometer, syringe, and needles with metal container. On the right side of the bag, from rear to front, we're going to put our test tube holder, medicine dropper, alcohol lamp with denatured alcohol, and match. On the left side of the bag, that will be from rear to front as well, we're going to put our medicine glass with suction, baby scale. Then at the back part of the bag, on the back side of the bag, we're going to put our solutions. The solutions that we need in the community, that will be Benedict solution, Lysol, boric acid, hydrogen peroxide, alcohol, and betadine solution. We are also going to need spirit of ammonia, or you can use kanang white flour. Then next, at the center of the bag. At the center of the bag, first we're going to put our kidney basin. After the kidney basin, the first cloth bag should contain Kelly curve, Kelly straight, and umbilical scissor, and then bandage. Properly secure it by tying it. Then, your next cloth bag should contain the sterile OS, cotton applicator, and cotton balls. Also at the center of the bag. The next is your hand towel, then your apron, your soap dish, and soap, or you can use kanang naay pump so it's easier for you to use. Then your apron at the center of the bag. I also added specimen bottle, since we're going to need this later when we do the nursing procedure, which is urine testing in the community. Also at the center of the bag. Then, we're going to close the inner cover. Then next will be our top pocket. On the top pocket, we're going to need our surgical gloves, sterile gloves, then paper waste bag, our waste receptacle, catheters, French 8 and French 12, then clean gloves later on for urine testing, and then plastic bag for our trash. Then next will be our linings. So for the linings, we're going to arrange them from bottom to top. So we're going to organize them according to the first lining that we're going to take out later on in bag technique. So first, we're going to put our soap dish lining. Next, our 12-inch lining. Next, our plastic lining. Next is the bottom paper lining. So you place it that way. It's then close it. Since you're going to let your bag face, the opening of the bag should face towards you. So, the paper linings should be placed this way. So, the opening of the bag should face towards you to prevent exposure of the opening of the bag. So you also bring with you your BP apparatus. So you're now ready to go to the community or to go to the family that is assigned to you in the community. So let us say, for instance, I'm already in the residence of the family that is assigned to me in the community. Knock knock. So explain explain why you are there. You can clip a planned visit outside the corner of the bag. Then ask the family member. After the greeting, you can ask the family member for an area, for a clean area for you to work on. So let us say, for example, this is the room or the area that is provided to me by the family member. So first, what you're going to do is to prepare your linings. So first, loosen your bag partially. Then take out your first or your bottom lining. Then next is your plastic lining. Next is your paper lining, the 12-inch lining. Then you're now ready to place to put your bag on top of the lining. So place it at the left side of the lining. So you can put your BP up there, then your bag. Then you tuck in these straps of your bag. Then take out the things that you're going to need for medical hand washing. So what are the things that you're going to need? Okay, open your bag fully. Take out your soap dish lining. Open the inner cover of the bag. Take out your apron, your hand towel, and soap. So close your bag. And then ask for the family member where you can perform medical hand washing. So let us say this is their washing area. So place your lining first. Open your lining. Put your soap. Then your hand towel. Then wear your apron before medical hand washing. After wearing your apron, perform medical hand washing. Put soap sa imong hand, perform medical hand washing. Right after performing medical hand washing, you dry your hands using your hand towel. Then, leave the hand towel, soap dish lining, and soap in the washing area. So you get back to your workplace. Next, take out all the materials that you're going to need for the nursing procedure, which is urine testing. So you open your bag again. Open the inner cover. So you're going to need your test tube holder, your lamp, your match, Benedict solution, medicine dropper, your specimen bottle or clean container that will for the urine specimen. You're also going to need your plastic bag for the trash later on, then your clean gloves, then waste receptacle. Next, place your waste receptacle in the table, then close your bag. Next, you're now ready to perform the nursing procedure, again, urine testing. So you explain the procedure to the patient. Sir, magkuan ta urine testing ta karon sir. Kani urine testing sir is buhaton ni siya para makahibaw ta kung naa ba sugar imong ihi. Ni ako na ay sugar imong ihi sir, makahibaw ta kung taas ra ba ang sugar sa imong ihi o gamay. Nya bali sir mag-collect tag urine sir ha. So you give the specimen bottle, you explain you instruct the patient to void and collect midstream urine. So kani midstream urine sir is inigihi mo sir dili pa ka mo sound sa imong ihi. Bali mo sound na ka sir mo inigihi mo count sa ka mga 2 to 3 seconds, then usa pa ka mo sound sa imong ihi. Bali tunga-tunga sa imong ihi sir, usa pa ka mo sound. Okay sir? So you you give this specimen bottle to the patient. Next is, while waiting sa specimen, di ba, sa patient, you can now wear your gloves. wear your clean gloves. And place this in the waste receptacle. So let us say, for example, you already took the urine specimen from the patient. So you already have the specimen. Next thing you're going to do is to prepare now your test tube, a test tube holder. You can use your test tube holder to hold on to your test tube. Place 5 cc of Benedict solution. Use your medicine dropper. So let us just say, for example, I already have 5 cc of Benedict solution. Next is you're going to put 8 to 10 drops of urine. So you use the other medicine dropper. 1, 2, 3, 4, 5, 6, 7, 8. So you're done. Then next, light your lamp. Next, heat your sample. So you heat your sample, then wait until you see bubbles. When you see bubbles, note for the result. When the color, if the color is clear, blue or green, meaning it's negative, there's no traces of sugar in the urine. If it is green with yellow precipitate, there are traces of sugar in the urine. If the color is yellow to green with yellow precipitate, meaning there's a little amount of sugar in the urine. If it is muddy orange with yellow precipitate, moderate sugar in the urine, meaning 3 positive. If it's 4 positive, meaning there's large amount of sugar in the urine, the color would be orange to brick red precipitate. So let us say, for example, I'm already done. I already noted the color of the sample. So it's blue, meaning there are no traces of sugar in the urine. Close your lamp. Then clean all the materials that you used. Let us say, for instance, I'm already done cleaning all the materials that I used. Next, remove your gloves. You place it in the waste receptacle. Then, place it in the plastic bag. Then you can ask the family member where you can dispose the trash. Then, next, you're now ready to put back all the materials that you used inside the CHN bag according to the arrangement, to their proper arrangement inside the CHN bag. So, open your bag. The left side of the bag, your medicine dropper, your lamp, your match, test tube holder, test tube, Benedict solution. You close the, next will be your soap, hand towel. Last will be your apron. So you just touch the sides. Then close the inner cover. After closing the inner cover, you're now ready to place your linings. So lastly, that will be the lining. So first, take your soap dish lining. So your soap dish lining, pick it up from the center, folding the contaminated area inside. Place it on the top of your bag. Then, close your bag partially. Lift your bag. Take it back to your arms. Hang it back to your arms. Then again, open it slightly. Then take your BP up. Then this is the contaminated area, right? So you just lift the side, close it with the contaminated area, fold it with the contaminated area inside. Then place it inside the bag on the top of the inner cover. Then the second lining, you hold in the center, you pick it up from the center, fold it with the contaminated area inside. Then last will be the bottom paper lining. Again, you pick it up from the center, fold it, again place it on the bag. Then close your bag, secure it with a lock, then you're done. That's it for bag technique and urine testing. So don't forget as well to record the visit in the patient's chart.